Thank you for taking the time to join us today to learn about one of the most successful and reproducible procedures for correcting degenerative arthritis in the hip joint. This presentation has been designed to help you in understanding the fundamentals of hip replacement. It's important to note that a diagnosis for your condition and its appropriate treatment are our top priorities. This video is simply an educational tool created with your needs in mind. So sit back, relax, and let's begin.
My life came to a standstill. I had no activity. I was very limited to any activity. I became a house person. I stayed home, watched TV, because the pain of getting in and out of a car or even walking to the car was so bad that I really didn't have any activity.
I was in excruciating pain. I couldn't walk, ride a bicycle, walk upstairs, or go dancing without pain or some type of medication to alleviate the pain.
Before we get into the basics of hip replacement, let's begin with an overview of the hip. The hip joint consists of the femoral head on the top of the thigh bone and the pelvic socket. Notice that there's a space between the ball and the socket. This space indicates the presence of cartilage, which serves as a cushion for the weight-bearing forces of the hip. When degenerative arthritis sets in, the cartilage in your hip begins to wear away over time, until you have raw bone rubbing on raw bone. This friction is the cause of the pain that makes even walking sometimes unbearable. This X-ray shows a hip joint plagued with arthritis. See how the space between the ball and the socket is missing? Unlike the previous X-ray. As part of your examination, your doctor will review your X-ray to determine the amount of cartilage remaining between the bones. You and your doctor can then discuss the specifics of your case and the benefits and risks of hip replacement. Total hip replacement is the surgical process of replacing cartilage that's been worn down between the femoral head and the pelvic socket with prosthetic implants. During the operation, the femoral head on the thigh bone is removed. A metal stem and metal or ceramic ball is attached in its place. The deteriorated cartilage in the pelvic socket is then removed and relined with a plastic, metal, or ceramic component. Now, the components rub together rather than bone on bone. Your doctor will discuss the kind of prosthesis and the exact surgical procedure that will be used in your case when the appropriate time comes. The main concern of anyone faced with having surgery is the risk of complications. You'll be happy to know that complications after hip replacement are relatively rare. However, there is some risk with any procedure. Let's discuss some possibilities that may exist. Infection is always a risk with any surgical procedure. Lab work will be performed to check your health condition before surgery is seriously considered. This lab work detects conditions such as heart disease, high blood pressure, and diabetes that need to be taken into account in planning your pre- and post-surgical care. Complications that are rare in occurrence but must be mentioned include component loosening, fractures, implant breakage, blood clots, and nerve or blood vessel damage. Your physician will be taking great care to reduce the risk of all of these complications. There are many designs and brands of hip implants available on the market today. You may have even seen a TV commercial for one of them recently. All are excellent products and are capable of successful clinical outcomes. Realize that the most important decision regarding your surgery is the one you've already made: the surgeon who will be performing your operation. Your surgeon will be taking great care in selecting the implant that's best for your particular case, and will be happy to answer any questions you may have. Anesthesia for your upcoming surgery is likely one of your greatest concerns at this time. The types of anesthesia used for hip replacement includes general anesthesia and spinal or epidural anesthesia. Prior to your operation, the anesthesiologist will carefully review your medical history, explain the benefits and risks of each type, and propose which approach is best for you. If spinal or regional anesthesia is selected, you'll be likely given sedatives to help you relax and put you in a light sleep. Computers are everywhere, and now they're available as a tool to help your doctor perform hip replacements. Computer-assisted surgery, also called CAS, is the latest in high-tech medicine. As you already know, during a hip replacement, prosthetic components are used to reline injured and damaged parts of the hip. Until the arrival of computer-assisted surgery, surgeons relied on their experience and special jigs to remove bone and shape the area receiving the implant. This new technology now helps the surgeon determine precisely how much bone to remove and align the implants, which, in turn, may increase the long-term effectiveness of the operation. To get an idea of how it works, think about those onboard computers and GPS navigation systems on newer cars. The onboard computers collect data points from satellites and use these coordinates to give drivers directions from point A to point B, much more precise than a paper map. With computer-assisted surgery, a computer model of your hip joint is created as a special instrument outlines the contours of the hip. In addition, the technology offers the potential to accurately place the implants through a much smaller incision. In summary, the objective of computer-assisted surgery is to combine the precision of computer technology with the experience, expertise, and skill of the surgeon. Whether or not your surgeon utilizes computer navigation for your procedure, hip replacement remains one of the most successful and effective procedures in all of medicine. How much will it hurt is probably the most common question patients have at this time. You'll be happy to know that there have been many developments over the past few years to help you be more comfortable after surgery. Pain medicine can be delivered in a number of ways: by mouth, by injection, by PCA or patient-controlled analgesia, which is where you push a button to deliver medicine into your IV, or by special pain pumps that deliver the medication right into your hip. Your doctor will be happy to discuss the pain management plan that's best for you. The important thing you need to do is to keep us informed of how you're feeling. You may be asked to rate your discomfort using a scale similar to the one you see here. We'll do our part to do everything we can to keep you as safe and comfortable as possible. There are a few simple things you and your family can do before surgery to help make sure your return home goes smoothly. In the kitchen, consider stocking up on frozen and canned foods. This will make meal preparation easier for you or your loved ones during the first few weeks at home. Relocate frequently used items and supplies between your waist and shoulder level. This may mean moving some items from top shelves to the kitchen countertop. Rearrange for easy access. If your bedroom is upstairs, it's probably best that you go up and down once a day at first. Prepare an area on the first floor for resting during the day. Place a phone within easy reach and consider attaching a bag or basket to your walker for carrying light items. Reduce clutter. Take a look around your home and remove any throw rugs that may be in use. Make sure electrical cords, footstools, and other potential obstacles are out of the way. Arrange for help. If you live alone, ask a friend or family member to stay with you at night for the first few weeks at home. Ask if they'll be able to help you with getting to appointments, grocery shopping, doing the laundry, and looking after your pet while you're in the hospital. Recovery time after hip replacement varies from person to person. It's important to work hard with your exercises and push yourself to return to your normal lifestyle. Remember, a positive attitude is the key to a successful recovery. Many patients return home from the hospital after 3 to 4 days. You can be driving your car around the 3rd or 4th week after surgery, slow dancing, golfing, and swimming after the 8th week, and playing doubles tennis around 12 weeks after surgery. Your doctor may advise you to avoid certain high-impact activities such as jogging, skiing, and singles tennis due to the pressure they place on the knee. We know the decision to undergo total hip replacement is a stressful and important one that you and your physician have to make together. We hope that this presentation has helped you gain a better understanding on which to base your decision.